And actually VPI is a topic that I'm very interested in, so I'm excited to talk to you about that as well. I do discuss the off-label use of a tissue filler called Deflux, which is actually FDA approved for use in kids who have urinary reflux. It's a copolymer that is a combination of hyaluronic acid with dextranomer microspheres. So I'm going to talk to you a little bit about what is velopharyngeal insufficiency, who gets it, what are some of the ways that we treat it, and a little bit about some newer things. So very simply, velopharyngeal insufficiency is really the incomplete closure of your velopharynx during speech or swallowing. If you have inadequate velopharyngeal closure, you can have some symptoms that relate really either to speech and or swallowing, and can consist of hypernasal resonance or hypernasality. If I see a patient and I'm talking to a parent or somebody, I always try to get them to clarify what they mean when they come in and they say their child sounds nasal, because often you have to distinguish that hyponasal, sounding like you have a cold all the time, which is what the parents whose kids have adenoid hypertrophy come in complaining of, versus hypernasal, which is the sound of too much air coming through your nose. Nasal air emission, so flow of air out of the nose when you should be getting good closure for speech, and that can be audible as a rustle. The compensatory facial motions that patients develop are called a grimace or facial grimace, and then they may be making articulatory errors or compensatory errors in order to try to achieve better velopharyngeal closure by stopping the airflow at the glottis. So that's kind of what you see in terms of speech. In terms of swallowing problems, it's really nasal regurgitation is the primary swallowing symptom, and that can be with liquids, it can be with solids. Oftentimes, for some reason, it's with things like chocolate. I get that one frequently, and I can only surmise that that's because people like to suck on their chocolate for a long period of time. And it can also lead to a weak or inefficient swallowing, which can increase your aspiration risk in some patients. Who gets VPI? It really is a pediatric issue primarily, but it turns out that kids and adults can